So,
Okay.
hey guys, so this is Dr. Walker. Dr. Walker, thank you so much for being with us. And would you mind if you shared with us what your career today is? And this is going to be the career we're going to talk about this month.
Okay. My specialty is physical medicine and rehabilitation. It's kind of a long title or name of specialty. Essentially, it is a cross between orthopedics and neurology. There's lots of different types of practices you can have even within my specialty. I do mostly spine and EMG, which is a peripheral nerve test. So do spine and musculoskeletal. There's some of physicians in my specialty that do neuro rehab, like spinal cord injury, stroke rehab. There's some that do pediatric rehab. And you can work in either the inpatient, meaning the hospital setting, or in the clinic. And I
That's
work most.
cool. In clinic. Yeah, that's really cool. A lot of the students in our medical club are very much interested in rehab, both for pediatrics and for adults as well. So hopefully you guys are looking forward to this one. So I'm just gonna, oh, whoops. Yep. So let's start with the first question. So the first question is, what was your path to your career, and why did you choose this specialty, which is physical medicine?
Well, I started out going to UW Eau Claire. I wasn't sure at the time I wasn't 100% sure I wanted to go to um, medical school. I thought even about nursing actually, but ended up pre-med pretty quickly after going to UW Eau Claire. I changed my major a couple times. I started out with biology major, chem minor, and thought, well, what can I do with that major if I end up not going to medical school? So I majored in biochemistry, molecular biology. A lot of the people in my major actually are doing research now at Mayo. But I ended up going to medical school in Madison, UW Madison. And there was a lot of our training in medical school was primary care through medical school. And even the rotations were very primary care and general surgery. And, you got a couple of the like OBGYN, and you got exposure to a lot of the basic specialties, but they didn't really expose us to physical medicine. I learned more about it from residents who were doing consultations on our services in internal medicine, and I asked questions about it, and I was really interested in it. I loved orthopedics, I loved neurology, but I didn't really care to do the surgery for orthopedics, and I wanted to do more for patients than sometimes I felt neurology had to offer. A lot of times you're making the diagnosis, but I wanted to do more for patients. And I liked that physical medicine focuses on function and quality of life, because when you think about it, that's what patients want. They want to be out of their pain. They want to do stuff, they want to be able to do things. So if if they're weak, if they're in pain, they can't do things. So you help them to have a better quality of life. And to me, that was appealing.
You kind of answered two of my questions at once right there, because I was going to ask you what
Okay.
was your favorite part of your job, and it looks like it's, of course, helping out the patients. So that's amazing. Thank you for that.
Yeah.
And then I think also along the same lines, what do you think is the hardest part of your job? Because again, as high schoolers, we like to weigh in the benefits and the not so beneficial ones as well. So what would you think is
Sure.
the hard part?
Well, I would say there's a few things with my specialty. If you want to know about my specialty in particular, um, There's the chronic pain patients that you can manage it sort of, but you're really not getting rid of it. So they keep coming back and they're still in pain and you're not, you know, so chronic pain can sometimes be challenging, number one. Number two, um, probably, I think initially with some of the neurologic injuries, people are pretty depressed about it, you know, and it takes them a while to accept it. So sometimes in the acute stage, you're dealing with a lot of people who are depressed about their injuries. That can be challenging. Um, what else? I mean, honestly, I think those are about it. It's sometimes some patients are just challenged. Oh, pangry patients. So people who are in pain are sometimes angry and they get angry at you because because you're not making them better instantaneously, you know. So pangry patients sometimes. But honestly, it's a great specialty because you have if you want a good balance because there aren't too many rehab emergencies. So you do have a life outside of medicine. Um, and you are helping people, you know, but you have a balance. That's been um, a huge plus for me having a family, and so
Yeah, and I think a lot of at least the members in our medical club are concerned about that work-life balance. So how exactly does a typical schedule look in your job?
yes. So in the clinic setting, it's pretty much an 8 to 5. You see clinic patients. Then when you go home, you're mostly done for the day. You do have call, but it's usually just okay, like you share it with your practice and it's just a few phone calls occasionally. I mean, I've been on call for a whole week and never gotten called. So it's pretty minor. If you work in the inpatient setting, the call you get more calls because it's just more acute. You have um nurses that are with patients around the clock and you'll get phone calls potentially if somebody with chest pain in the hospital or whatever. You have more urgent things that happen even on the rehab unit. They're supposed to be medically stable, but stuff happens. So you will get more phone calls if you do inpatient. But I would say I probably put uh, in and most people put 40 to 50 hours a week in clinic, and you don't work weekends if you're just doing clinic.
That makes a lot of sense, and that's very informative as well. And I think my next question is probably going to be, if you look back, what do you think would be something you would have changed in order to get to your career path? Because I think it's a good idea to be warned about something beforehand. So what would be that one
Yeah.
thing you would caution someone about, or you would change about something through your whole medical path?
That's a good question. I do think now there's more requirements for you to have experience before you ever have experience. And I don't know how students get that because we weren't required to do that as much. But you guys, it seems like there's more pressure for you to have some sort of medical experience so that you know that you want to go into medicine. So they're looking for that more. I've heard on medical school applications, like how do you even know you want to be a doctor? So what have you done in the medical field? I think just getting some experience, even just volunteering or doing something. And then but for me, regret probably um taking advantage of opportunities for learning. Like if you see a patient or somebody's showing you x-rays, be compulsive and just sort of follow up on like make a note, like keep a log of all the patients you saw with residents and follow up on them how they did, because I think you learn the most from the follow up. Or if you, yeah, you know that a service ordered some test, go down into radiology and go look at the test with the radiologist, or go be compulsive and learn everything you can about every patient that you see, um, as you see it, and do the follow up, I guess, and read up on the patients as you see them. You'll learn a lot more that way and take advantage, because once you're out of residency and right out of medical school, it's a lot harder to keep up with and keep learning. The lifelong learning is tough. Um,
Exactly. Yeah. And I think that's a really good tip because a lot of the times we just think of that textbook definition of doing things. And then once we're out in the field, actually by ourselves, we forget to do those things. So thank
yeah,
you so much for those tips. And thank you so much for all the time you spent with us.
sure.
Everybody, this was Dr. Walker. And thank you so much, Dr. Walker, for giving us all this information. And we hope you have a really good time this new year.
Yes. Happy 2022. Good luck to you all.
Thank you. I'm glad our medical club was able to have your interview with us. So thank you so much.
You're very welcome.